neuroscientist and best-selling author,
and one of the world's leading researchers in sleep science.
It's going to blow your mind. There's a global sleep loss epidemic shaped by this thing called the modern world. What society wants is that you're either producing or you're consuming. In fact, the CEO of Netflix, his statement was that we are to commit war against sleep. We have this mentality in business. Less sleep equals more productivity. That is just not true. Insufficient sleep costs most nations about $411 billion.
Jeez.
Your rates of obesity, cardiovascular disease, mental health conditions, all of these things escalate. If that wasn't bad enough, if you're not getting sufficient sleep, then 60% of all of the weight that you lose will come from lean muscle mass and not fat.
Not the muscle. Why do we sleep?
It's a puzzling question because when you think about it from an evolutionary perspective, it makes no sense whatsoever. Sleep is utterly idiotic because when you're sleeping, firstly, you're not finding a mate, you're not reproducing, you're not foraging for food, you're not caring for your young, and worst of all, you're vulnerable to predation. Now, on any one of those grounds, but especially all of them as a collective, sleep should have been strongly selected against during the course of evolution. But from best we can tell, sleep evolved with life itself on this planet, and it has fought its way through heroically every step along the evolutionary path. And what that has told us is that sleep must be essential at the most basic of biological levels. And now we understand that Mother Nature didn't make a spectacular blunder with this thing called sleep. Sleep, for example, will restock the weaponry in your immune arsenal, and it will make you a more immune sensitive individual. So you're more immune robust when you wake up. We also know that it regulates your blood sugar levels. It controls your appetite hormones. It also regulates your sex hormones, testosterone, estrogen. Sleep upstairs within the brain will fixate memories and help you learn and remember. Sleep will de-escalate anxiety. It will reduce your emotional difficulties and traumas. Sleep will actually cleanse away the Alzheimer's toxic proteins that build up in the brain. The list is endless. These are all of the reasons that we need to sleep. Sleep, I would argue, is the single most effective thing that you can do to reset your brain and body health. And I don't say that flippantly. It's not as though I'm dismissing exercise or diet. Those two things are absolutely critical. But if I were to take you, the individual, and deprive you of exercise for a day, deprive you of food for a day, deprive you of water for a day, or deprive you of sleep for a day, 24 hours, and I were to map your brain and body impairments, it's not even a competition. That one night of lost sleep relative to those other things, it dwarfs, the only thing I lose out against is oxygen. If I deprive you oxygen, you're going to pop out of existence a little bit quicker than you will with a lack of sleep. So sleep to me, I think, is the elixir of life. It is your life support system. And as best we can tell, I would argue it's Mother Nature's best effort yet at immortality. Here in the United States, the average amount of sleep that people are getting is 6 hours and 29 minutes. In the UK, it's not much better, 6 hours and 49 minutes. Japan was the worst, 6 hours and 22 minutes. Now, to be clear, that's the average. What that means is that there is still a large proportion of that bell-shaped distribution of people getting even less than that amount. Underslept employees will take on average about 11 more days, sick days throughout the year relative to well-slept individuals. So you're essentially just paying people additionally for 11 days of work that they will never give you when you are undersleeping them. Secondly, the utilization of healthcare resources increases by about 80%. So the cost to either you, the company here in the US, where your company is paying for your healthcare, or the cost to the government, for example, in the United Kingdom, is astronomical. And also then what we call comorbid diseases, your rates of obesity, diabetes, cardiovascular disease, mental health conditions, all of these things escalate as underslept employees continue to get even more underslept. I don't remember, and maybe you can, but any major first world nation government that has had a public health campaign regarding sleep. And it stuns me because those same governments have had public health campaigns regarding, eating, regarding smoking, regarding drunk driving, regarding risky behaviors, safe sex,
Loneliness.
loneliness, mental health, suicide. Where is sleep in that equation? And it's such a fundamental ingredient. And in fact, almost all of those things that I've just described have an intimate relationship with sleep. I mean, suicide, especially, we're starting to do a lot of work with this, although it's been hard to get funding. But what we found is that insufficient sleep is a precursor to suicide. That sleep disruption seems to predict both suicide ideation, in other words, suicidal thinking, suicide planning, and tragically, suicide completion as well. So, if we were to try to have governments create a public health campaign to pull this Archimedes lever on better sleep, there are so many other health benefits. Sleep is the tide that rises all the other health boats. We need to get companies to actually start embracing sleep. And I can guarantee you, and I can give you all of the evidence as to why, if as a company, as a CEO, if you start prioritizing the sleep of your employees, you will be far better off as a company. You will be more product based and you will be more profitable and revenue generating. Sleep is the very best form of physiologically injected venture capital that you could ever wish for. And in fact, the RAND Corporation, which is an independent survey corporation, what they found is that at a national level, insufficient sleep costs most nations about 2% of their GDP. So here in America, that number was $411 billion of lost profit caused by insufficient sleep. In the United Kingdom, it was over $50 billion. In Japan, it was over $120 billion. If I could solve the sleep loss crisis in the workplace, I could perhaps double the healthcare benefit for many of those countries, or I could halve the education deficit in those countries. So the next level I would target is at business. Then next step down would be medicine. Medicine is a classic demonstration here. We have junior doctors, or here in America, they have doctor residency programs where people are working 20, 30-hour shifts. And so already doctors are inculcated into the mindset of the uselessness of sufficient sleep across numerous countries. And I think it was maybe over 8 different countries. We looked at the medical curricula and we asked how many hours of education do doctors get about sleep? And what's strange is that, often doctors, you'll go in and you'll have an appointment, they'll say, okay, how are you eating? And, what's going on with the bathroom? How's the toilet? And then, how are you sleeping? As if sleep is one of these universal health barometers. But what we found is that most doctors will only be given about an hour to an hour and a half of sleep education during their entire medical school education, which blows my mind because it is 1/3 of their patients' lives, but they're only given about 90 minutes of education. So no wonder your doctors aren't treating your sleep problems, thinking about your sleep problems, understanding your sleep. It's not their fault. And plus, they're sleep deprived anyway when they're being trained. Ironically, by the way, doctors, junior doctors who've worked a 30-hour shift, when they finish that 30-hour shift and get back in their car, they are 168% more likely to get into a car accident because of their lack of sleep and end back up in the emergency room from where they were just working, but now as a patient. I mean, the paradox, the irony just stuns me. So I would next move down to the level of medicine. Then I would go to education, because we don't get taught about sleep in schools. I never got one of those special classes. I got sort of, sexual education classes, classes about drugs. No one came in and told me about the benefits of sleep. Why aren't we doing that?